I'm Dr. Julie Ann Corcoran. I'm a general surgeon here at Washington Health Systems, specializing in minimally invasive surgeries and robotic surgery. I am a board certified general surgeon as well as a fellow of the American College of Surgeons. Some of the benefits of robotic surgery include smaller incisions, less risk of hernias at those incision sites, less blood loss, less pain, as well as getting out of the hospital quicker, sometimes even same-day surgery, as opposed to being admitted to the hospital at all. Not only that, people get back to their lives quicker with less pain and more ease. The DaVinci System has a 10 times magnification camera, so it allows you to see smaller items and a much bigger visualization in a bigger field, which helps with your procedure overall. Additionally, there is Firefly technology, which is a way to look for blood supply and biliary supply to different organs. With that, we're able to look at the tissues to make sure that they're healthy and viable to decrease the risk of complication after surgery. One example would be in a colon case or a bowel case where you're taking a piece out and putting two pieces back together. You want to make sure that those are two pieces that are healthy, that will heal and grow back together to avoid leaks or issues of that nature. Not only does the camera have 10x magnification, but it also provides a 3D image. So when you're looking at things through the robotic camera, you're seeing them more lifelike, as if you were touching them with your own hands and seeing them with your own eyes versus a flat screen. On that same note, the robot allows you to have wristed instruments, meaning that the instruments themselves rotate like your actual wrist. So when you're performing the procedure with the robot, it feels more like you're doing an open procedure, and you're able to get into tighter corners and perform different moves that are virtually impossible laparoscopically. I've truly seen the benefit for my patients, and that's my absolute goal, is to give my patients the best possible procedure and the best possible outcome as I can. In training, robotics was still coming around, so most of my training was in laparoscopy, so I had to go and get the training on my own, and I've enjoyed all of the training, and I think that it belongs here in this hospital, and I think it gives our patients a great alternative to some of the older methods of doing things. I find that my patients have less pain, and nowadays trying to avoid pain medication is crucial, and my patients aren't needing as much pain medicine or pain medicine as long, which is very important to me. I also see them going home quicker, often the same day, so they're not exposing themselves to the hospital during the COVID crisis, but yet they're still getting the care they need and getting taken care of. My patients are very happy with the way their incisions look afterwards. Having small incisions versus a big incision is really important. And again, them getting back to their lives quicker. So not only not being in the hospital or getting out of the hospital quicker, but actually enjoying their families, getting back to their work and their livelihood quicker is very important to them. Therefore, it's very important to me. A true testimony of the technology of robotics here at Washington Hospital is a patient of mine who many years ago had an open groin hernia or an open inguinal hernia repair done. It was such a miserable experience for him, and he had pain for so long that he put off getting the other side fixed. I met him along the way, and he came to me, and I told him we were going to do it robotically. He was a little skeptical at first, but went through the surgery, felt so good and had so little pain that he ended up going to work the next day to drink coffee with his friends because he was bored at home. So he says if he would have known how much better it would have been, he would have done it years and years prior and wouldn't have put it off so long. If someone would like more information about robotic surgery here at Washington Health Systems or any other surgical service, visit us at WHS.org.